Okay, next up, we're going to hear from a panel of representatives from resources, places for resources, and we are going to hear from Amy Camberland from Angel Flights, Emily Reed from Vermont Therapy Dogs, Mary Beth Gurin, I hope I pronounced that right, and Morgan Burnett from the Muscular Dystrophy Association. If you want to come up here at the table, we'll figure out the microphones for you.
I'm Amy Camerlin from Angel Flight Northeast, and I've had the lovely experience of talking with many of you so far. Angel Flight, we fly children and adults to and from medical treatment for free of charge, and we were founded in May of 1996, and we celebrated 21 years this past summer, and we have flown over 14 million miles with over 53,000 patients, our youngest 3 days old, our oldest 99, and we have flown over 75,000 flights. So Angel Flight was founded in a small airport in Beverly, Massachusetts, funded by the founder, who was actually, full disclosure, my father. But I worked my way from the bottom. I was hired to clean and organize. Not that that's the bottom. It's actually my favorite place to be because I can't think straight if I'm not organized first. So I actually really enjoy that. I still vacuum and take the trash out. Anyhow, he owned ambulance companies and retired at 45 and decided that there had to be a need, and he really wanted to fly. And so he read an article that there was this need of children and adults needing to access medical care. In the Northeast, people, as you may know, being in Vermont, can live, with 5 hours away from some medical facilities, especially if you have an amazing campus here, but sometimes there are clinical trials or infusions for different genetic diseases, and they might be offered quite a distance to New York, Boston, Dartmouth, Hitchcock. So he found with that need, he would put his flying lessons into Angel Flight, and he founded Angel Flight. And we're based with 1,000 volunteer pilots, and they're all over the Northeast, Vermont, all New England, New York, New Jersey. We fly patients as far as down to Duke in North Carolina, all the way up through Caribou, Maine, Vermont, University of Pittsburgh, Ohio, Cincinnati, Ohio. But we've been able to conquer a larger scale because one of our corporate sponsors is JetBlue. So wherever JetBlue flies, we can fly our patients. Many people think it's just for children, and while over 30% of our flights are children, the majority are adults as well. So we also provide compassion flights. So if you have a child or a spouse or a loved one, a brother, sister, mother, father, in a hospital or in a hospice or in some program, and you need to access them, but you need to go home to work, we will fly you. We will fly loved ones to be able to see and access their loved ones, because we know that many times someone could be in the hospital for a long period of time and someone needs to go home and work and then come back. So we're very happy with our compassion flights, and we fly transplant patients as well. And we would welcome therapy dogs any day on any of our flights. We never turn anybody away. It's an honor system. We would never ask anybody and say, well, how much money do you have, or what kind of insurance are you on? Because we know that throughout America, middle America, people have budgets. People are working. They have their homes and their mortgages and their cars. So oftentimes, if you're a single person, you're a single income. And so we know that there is a need. Commercial transportation is hard. Driving far is difficult. Oftentimes people have to stop working or cut back on working to take care of a loved one that's not well. So there's no documentation We just simply say if you can afford the multiple commercial airlines tickets, please do so so that we can help the people that really need to be helped. But, you know, we've never turned anybody away. We've never really had anybody manipulate our system. We might have someone call us up saying, can you get us to Disney World? And if they're not with Make-A-Wish, then we're not taking them. So, and we're very proud, during the marathon bombings, we've been flying amputees to be fitted for prosthetics. We were the only people in the sky after 9/11 through the FAA. The Red Cross were not given permission, but we were. So the day that that happened, I was on the phone with FEMA, SEMA, the governor, everybody in New York, Washington, Pennsylvania. We had 150 pilots sign on right away, and we were flying the search and rescue dogs. We were flying the volunteer firemen and EMTs and responders from all over the country that signed up, because during that time you were only allowed a 1-week rotation due to the gravity of the unhealthy air quality and the level of trauma that they were experiencing. So we were proud that although it was hauntingly quiet during that time, we were flying into Teterboro Airport. They weren't open, but the FAA, I was on the phone with them till 3 in the morning because, you know, every pilot had to have a security number, and, you know, we had to be very careful. So our services, we run a big scope so we can immobilize during the times of crisis too. We helped Katrina, we're helping Houston, and we're helping Florida at the moment. But with genetics, and what makes this so special and unique is that as we listened this morning to the wonderful physicians that were talking to us, you know, there's a name, that's why there's rare, you know, and so sometimes you need to find different, about NIH, you know, you may have to go to New York or Washington, D.C. or Boston for different infusion therapies or for consulting or for diagnosis. So that's where, you know, Angel Flight would be, you know, more than happy, and we're always here for that. We will fly patients for as long and as often as needed. And once you call our 800 number and give your information to our staff, we take care of you when you need to fly. So you tell us what time, and you tell us what airport's convenient for you. And you're our #1 priority, and your convenience is our goal. And making you feel safe and comfortable in your travels is of utmost importance for us. And lastly, so I don't take up too much time, we have a wonderful partnership with Hasbro. So for children that frequent our planes, they're always greeted with toys to take home. Brand new toys, travel toys, toys to have at home. And Hasbro also created a plush Mr. Potato Head pilot, Angel Flight pilot. And so he's on every flight and goes to every child, along with lots of wonderful games and goodies for the children. And you'll find, as grown-ups on our flights, oftentimes our pilots will have blankets and books and snacks and a big ear and wonderful shoulders to lean on. So we're very proud of that. And my information is right out in the lobby if anyone needs it. So thank you for having me here. And I hope I didn't talk too fast. Thank you.
My name is Emily Reed. I am here today as a volunteer with Therapy Dogs of Vermont. That's Olive. She's also here volunteering her time from Therapy Dogs of Vermont. Olive has been working with the organization for about 7 years now. She's my old, quiet lady. So she's great for these events because she's nice and docile. She's also great for nursing homes and things where a lower energy level is needed. I have another dog at home named Benny, and Benny is a young, much more energetic, lively guy, and he is definitely drawn to working with kids and environments with more energy. So that's why I brought her today, because I knew there'd be a lot of needing to hang out and be still today. So what I wanted to just explain a little bit about is the organization. Therapy Dogs of Vermont is a homegrown local organization. It's been around for more than 20 years. We were founded by a gentleman named Steve Ryman, whose first 2 therapy dogs started working at the University of Vermont Medical Center back when it was not named that. It was the MCHV hospital at that point in time, and he had 2 German Shepherds. And they used to come and visit with people at the hospital. And then it just grew from there. So if you can kind of think in your mind about any place that would benefit from a dog bringing a smile, there's likely a Therapy Dog of Vermont stationed there. We work in all of the hospitals throughout the state of Vermont. We work in a lot of the nursing home facilities, level 3 care homes. We work in schools in the area. Some of the local libraries have reading programs for children. We have a lot of children with reading disabilities who have a lot of apprehension about reading to people, especially adults. But dogs carry no judgment. And therefore, if you have somebody who's a little nervous about reading to a pup is kind of, it's a non-intimidating way to practice your verbal skills. So we're in reading programs. We also have been, a new initiative we started last year was increasing our outreach to veterans. And we also are finding more and more opportunities in the corrections system and the court system. So we're expanding everywhere. So we're always open to new opportunities and ways that we can bring smiles to people. I'm fascinated with a new interest I just discovered, which is being with kids during difficult circumstances to reduce the amount of sedative or anything like that that might need to be done. We had a young lady who was successfully given stitches in the emergency room at Central Vermont Medical Center a couple of weeks ago without the use of any sort of sedative by just having one of the therapy dogs stand there with her at the time. So it was great fun. So the experience, we are all volunteers. None of us are paid. We just do this because, one, we love our dogs. First and foremost, she's my pet. She's my family member. But I love spending time and finding ways to go out there and do things with her. So this is why we got into the work ourselves. I'm also a social worker, so it's something I enjoy doing. But also, it's just an amazing opportunity to volunteer. It's really introduced me to different populations and different opportunities that I hadn't had before. So I've appreciated getting out there. I'm a native Vermonter. I was born at the hospital across the parking lot, but it's really introduced me to different populations and different opportunities that I wouldn't have found without having a dog with me. And until you do the work, it's really difficult to describe, and we all have these phenomenal stories about different things we've encountered. But I remember one of my favorite was with Olive a few years ago. We were at the Star Farm Nursing Home in Burlington, and there was a gentleman who was in the hallway and just sitting in a wheelchair. And we went up and started talking to him. And at a nursing facility, you know that people have all sorts of different abilities and different deficits. And so we simply just sat next to his wheelchair. And the nurse came by and she said, "Oh, I can't remember what his name even was. Oh, Mr. So-and-so, he doesn't speak. He's had a stroke." I said, "That's okay. We don't mind. Olive doesn't mind. We're just hanging out." And he kind of gently was patting her head. And then he looked at me and smiled and looked at Olive again. And he just said, "I." And we just stayed there. And then about 15 seconds later, he said, "Love." And we just stayed there for a little while longer. And then he said, "Dogs." And so we stopped at the nurse's station on the way out and we said, "Mr. So-and-so, he can talk. You just got to give him time." So those sorts of stories, they just keep us motivated and keep us going. And so I can't imagine not doing this work. We train all our own dogs. It's a great process to go through, and I would encourage anybody interested in it to kind of take a look. We have a website that we advertise on, and it's a kind of a two-part process where one, you would come in and take a test with your dog. We test their temperament and their obedience. We can't have anybody being dragged around the facility, knocking anybody down. We like dogs who like people and are okay around different settings. And then we take dogs in and we practice in facilities for 3 to 5 times sessions. I'm one of the trainers who will bring people into the facilities, and we practice. And then once you do that, you're certified as a member, and you can go out and spread love, which is a great opportunity. So I do have some business cards and a few brochures out in my backpack here. I don't have a booth outside, but I'm happy to share if anybody would like more information.
I'm Morgan. I'm with the Muscular Dystrophy Association. This is Meredith. She's with the Muscular Dystrophy Association as well. MDA is a national organization. However, I am the local family care specialist, so local to Vermont. I actually just started with this position quite recently, but have been with the MDA for a little over a year now. The Muscular Dystrophy Association on a national level, we talk about mission with 3 different C's: cure, care, and champion. We cover over 43 different neuromuscular diseases, so ALS, SMA, different mitochondrial diseases, Duchenne. There are a variety, but some specific services that we offer on a national level are MDA care centers, access to clinical trials, different studies, support groups. We also help families and the people that we serve navigate the school system, the education system, as well as insurance. On a local level, I feel like we're also a pretty strong advocate for our families, so helping them find their own voice and advocate for themselves, as well as be an advocate for them. We also have summer camps nationally. The local one for Vermont is located in Lake Luzerne, so it's about an hour and a half from Burlington. It's a really magical place called Double H Ranch. We also offer some transitional support, public advocacy programs, but for my role specifically locally in the area is to not only take a multidisciplinary approach to the treatment of those that we serve, but also the way that we look at the MDA community and how the Vermont community can support the people that we serve. So providing access to local programs that may not be through MDA, but are of a local service. So something like Vermont Therapy Dogs, but that's really and truly my goal as a family care specialist within the Vermont area. Anything else?
Yeah, I think that with our title being the Muscular Dystrophy Association, sometimes there's the assumption that we're limited covering diseases that might just be muscular dystrophies, but it's so important that everyone recognizes that there are 43 different neuromuscular conditions that fall under our umbrella. So that does include metabolic diseases of the muscles like mitochondrial myopathy and peripheral nerve diseases, motor neuron diseases, diseases of the neuromuscular junction like myasthenia gravis. So if you're not sure if your rare disease might fall under our umbrella, you can stop by our booth and check in with us, and we can let you know if that's something that we might be able to cover and provide you some support and resources with. We also do have a lot of national programs that we're currently growing and expanding upon. We do have a policy and advocacy department. So that's a platform for families to enter their local contact information, and it automatically generates who your local politicians are. And it provides a 5-minute way to give you a voice to express what your thoughts and opinions are on some of the important current initiatives and things that are going on as far as public advocacy. So that's a really neat tool that we have. We also have a clinical trial locator on our website, so that helps you navigate different clinical trials and research studies that are currently going on. We also have a young adult program, which is a very unique service that we're providing. We offer one-on-one peer counseling with a young adult who's currently living with a neuromuscular condition as well, who provides great input and advice and a really great mentor to some of our young adults going through that transitional age, as well as internship possibilities within MDA for young adults living with neuromuscular diseases, and lots of information on education and scholarships, employment, and independent living resources. So there's a lot of resources that we're able to provide to the families in the area. And if it's not something that we can do directly, we're definitely able to help and do our best to link you up with those resources that can.
Comment real quick, if you don't mind, after hearing all these lovely ladies talk about the different camps that they might help. We also will fly children to camps. There are many camps throughout Maine, New York, New England, the Northeast, or the country. But also, if any of you, like for instance, today's Rare and Infectious Disease Conference, we would have flown you here if you needed to access this. So whenever there is information for families about specific illnesses and people want to learn more, we are just as much wanting to provide flights for people needing more education, because that is so empowering and so important, especially rare infectious diseases, all the diseases you just mentioned. There needs to be more education. Families should be empowered with this education, and the patients. So we're not limited to just to and from the medical treatment, but as Dr. Solomon mentioned from the NIH, if there was a study or for diagnoses, those would be our compassion flights. Thank you.
Sorry. So medical supplies like saline bags, enteral feeds when flying. A commercial airline such as JetBlue, do we need a doctor's note? Do they assist us?
So that's a great question. So our flights are mostly for patients that are ambulatory. They can be wheelchair bound as long as the wheelchairs are collapsible and can be stored in our planes. Oxygen tanks, that's no problem if people are on O2, as long as they're portable and that they're safe for flying. Every patient that comes through Angel Flight does have to have a doctor, a physician sign off that it is safe for them to fly. We want to make sure that they are safe, that they are ambulatory enough. We always encourage our patients to bring a loved one, a best friend, if you're a grown-up, obviously if you're a child, a loved one. As far as if they need to be on, are they on IV? Do they have, that's a good question. We have flown people with nurses. So she has.
She has a PICC line.
So a PICC line.
And NJ, which is going to be GJ soon.
Yes, so we would, as long as she was stable, we could fly her.
Okay.
As long as her physician knows the environment in which she's flying, and he says it's okay, then that would not be a problem.
Okay, good. Thank you. Yes, that too.
No, we don't have.
Is that what you're asking? Because if we're traveling, like right now we're driving back and forth to New York City for all of these appointments with our specialists. So, we're taking coolers of saline bags.
We would not have a problem with that, because
Okay.
we also fly for transplants. So we have flown organs for transplants, we've flown transplant patients. But no, we don't have the regulations on liquids, or as long as everything was safe.
Yes,
Then
it
it would
is.
be okay, yes.
Okay, thanks.
Thank you.
You
I was-
can leave this one.
I was just going to say, I've used Angel Flights with my son, and it was wonderful. It was really great. I do remember he needed to be able to climb onto the wing, so now that he's uses a wheelchair, he's like, wouldn't be able to fly
So in that
on
case,
those little planes anymore.
right, so in that case, what we would do is we would make sure that there would be a different aircraft. So if you would specify now, we would have a different pilot, different aircraft. Also, now that we have this partnership with JetBlue, Penn Air, and Cape Air, we would be able to make sure that he would get to where he needs to be.
Okay, so quick question, you mentioned Cape Air, is that
Yes.
like Cape Cod?
Yes, so that would be the Cape and Islands.
So my son goes to camp on Martha's Vineyard every summer.
So we could fly
You
him
can
there.
fly him
Yes,
there.
yes.
So crazy.
Absolutely. Call me.
And I have a conference in Arizona next summer that I wasn't sure I could afford to get to.
Well, if you need to get to that conference and it pertains to rare infectious diseases, we will put you on JetBlue.
Wow.
As an Angel Flight Compassion Flight.
Yes, I am
Yes.
blown away. Thank
So
you.
I will make sure to give
Yeah.
you.
I met Julie in Arizona last year. So. Yeah, we had a good time.
I see travel in your future, Joanne.
Much travel.
Tuesday, DC.
No, please call. I have more information outside. I'd be happy to give you my personal cell phone too. But there is an 800 number, and we have a wonderful staff in North Andover. So please call.
Thanks so much.
You're welcome. Thank you.
Oh, yeah. It's really nice. Thank you.
Thanks. I had two questions about the angel flights, and you partially addressed one. And just to make a clear distinction between a medical flight where you know there are monitors and things, and there's a nurse or a doctor with you, and they're trying to get you to care. It's at a center. That's not the same thing. Correct?
So correct. So with ambulatory, meaning that you would be able to safely get on and off of a plane without the help of medical personnel. Or, so for instance, we do get that question often about people that need to get their loved one home because unfortunately they've been in an accident or they become very ill. Unfortunately, what we have to, we try to direct people. There used to be the national hotline, NPAP, that people could call, but it's still, you know, that's a need. We've had people that have had to resort to an ambulance and have had to go by ground. Other people, once they were stable, would travel by train. You know, that still is something that is a need for sure because it's very, very expensive for the air ambulances today. And we are trying to look into more resources so that we can direct people that can find something that isn't so costly.
And then the second question was about on the JetBlue ones. Those are commercial flights running on a schedule to commercial airports, and then you also have some other flights available that are more that are not commercial flights and may fly in the non-commercial airports. Is that right?
Correct. That's a great question. So we do fly out of a lot of the small and rural airports as well as the large airports like Burlington or Logan Airport. And so we have over 1,000 volunteer pilots that, like the lovely woman, the blonde up here in the
Joanne.
Joanne, thank you. As she mentioned, we do have some 6-seater airplanes where you would climb up onto the wing into the plane.
4-seater.
Or 4-seater.
We
Okay,
had
so
a-
4-seater.
We were on a 4-seater. This is kind of funny because we saw the guy and he's like 90, well, I don't know, he looked like he was about 80 years old. So
Our cutoff- our
and then we saw
cutoff
the
is
plane and it
68.
was like the little Snoopy plane, you know. It was a very small 4-seater, like 1960s shag carpet on the inside. We were pretty nervous. This was our first flight and it ended up being our absolute best flight. The men were lovely. They were awesome. They co-shared the plane. The plane was safe, but it never got too high, so we had beautiful views of Lake Champlain. We were going down to Philadelphia. So it was...
That's
yeah.
so good to hear, and it can be intimidating. But I want you to know we have a very rigorous process. This is important too that I'd love to share. When a pilot calls us up to join Angel Flight, they have to have a minimum of 1,000 hours solo. They also have to have all their medical forms, everything to us to know that they are annually making sure that they are healthy and fit to fly, because the FAA will grab your license real quick for any kind of visual change or health change. The other thing is we have to make sure that we see your entire log on maintenance on your plane, and that has to be updated monthly. We need to make sure that you're taking good care of everything. It's a very difficult process to be vetted, to be an Angel Flight pilot because of our precious cargo. And we're very thankful. A lot of our pilots are actually physicians, lawyers, judges, educators, professors, and they are donating their plane, their time, and their fuel. We have 9 full-time staff in North Andover, Massachusetts, coordinating over 1,000 pilots throughout the Northeast. But again, we can reach greater areas. But you will oftentimes find the 4-seater, the 6-seater, the 8-seater. We do have some planes that are twin-engine jets that are very fancy. And if we're going further distances or have larger groups of people, we will reach out to that specific pilot. But safety and comfort is our #1 priority. Thank you for.
I have a question. I'm sorry, I don't remember your name of the therapy dogs. Emily, hi. Do you have any connections with service dog organizations?
We don't. It's a great question because we get a lot of people who are interested in therapy dog information, and what they're really interested in is more service-related information. So essentially, there's kind of 3. There's probably very many more, but we get a lot of questions about service dogs. We also get a lot of questions about emotional support dogs. So the service dogs are the federally protected dogs that are trained to do a specific function for somebody with a disability. Emotional support dogs are that individual's support. They're not federally protected like the service dogs are, although there's a lot of debate going on right now with that. And then the therapy dogs are simply volunteers. They can be touched. So I get a lot of questions when we're out and about they kind of, have been vetted and assured that they're not supposed to interact with service dogs. So I'm always assuring people that she can be touched. That's her role. Her role is to have people touch her and enjoy her. So we do not have any current relationships.
Thank you.
I made that confusion when your voice came in.
Does the therapy program, does anybody go into like people's homes?
We do not. Our insurance that we have, so when you're certified with our organization, Therapy Dogs of Vermont, you're also covered by our $1 million liability process. And so they do not cover us to go into individuals' private homes, unfortunately. I wish we could.